So what I've been asked to address is, how do we know that the COVID vaccines are safe for people who are pregnant or planning a family? And as Venice kindly said, really, my experience in this has been very practical. It started when I volunteered to become a vaccinator, and we were vaccinating healthcare workers at the time. And of course, some were pregnant or were planning pregnancy. And so questions were coming, and as the jobbing gynecologist giving the vaccines on the day, these questions came towards me. And what's absolutely crystal clear is that everybody wants to do their very best to protect their future child or children, and that's whether they are currently pregnant, planning pregnancy in the short term, or perhaps thinking about something much further down the line. And so to have safety questions is totally reasonable. Now, safety, of course, is really another word for a balance of risk. And certainly with regard to when a person is trying to get pregnant or is actually pregnant, there does need to be a good reason to take any medication. I'm not sure if you've got my slides, but if so, could you please go on to slide 3? So what I'm going to talk you through is the effect of what we know about COVID in pregnancy and COVID and trying to conceive, but also about COVID vaccinations in both pregnancy and those trying to conceive. Next slide, please. So how do we actually know that these COVID vaccines are safe? Well, the starting point really is to think about the past experience of vaccination. And we've been giving vaccines in a routine fashion to large proportions of people since the 1950s, with a great deal of success. So smallpox was eradicated with a global vaccination programme which started in 1959. Polio has been almost eradicated, and vaccines against polio have been in use since the 1950s also. And then more recent vaccines include the mumps, measles and rubella vaccine, tetanus, the human papillomavirus vaccine, and that's the one that's given to protect women and their partners, but particularly women, against the risk of cervical cancer. There's vaccination against TB, and one that's particularly relevant for healthcare workers is the vaccination against hepatitis B for those who are doing needle stick prone injuries. And so we've been giving both live and non-live vaccines for over 70 years. And these have been given in infancy, childhood, adolescence, and as well to adults. And we've had no indication that there's ever been any effect on fertility. So that's a pretty good starting point for any concept of vaccine. In addition, we've been giving non-live vaccines routinely to pregnant women for many years. And the two common ones that are given are against flu and whooping cough. And these are non-live vaccines, which is the same as the COVID vaccine, which is another non-live vaccine. And just to be clear, because some people might be aware of the fact that there is a vaccine where people shouldn't try to get pregnant for a month after receiving it, and that's the rubella vaccine, and that's because that is a live vaccine. So I find when I'm talking to women about being vaccinated against rubella, if they are susceptible to that virus, is that it's not a surprise to most people that they know that they should not try to conceive for 1 calendar month after receiving the dose. However, that is not true for any of the COVID vaccines, and it is not necessary to interrupt trying to get pregnant or to delay starting trying to get pregnant for any particular amount of time after receiving the vaccine against COVID. In other words, you can do both at the same time. Next slide, please. Now, the next bit of data we've got comes from research trials. So when the COVID vaccines were being developed, it's routine as part of drug development that there will be some animal experiments performed. And the COVID vaccines were tested in rats, which is a fairly standard animal to test this type of drug in. And there were no effects on the rat's fertility, their pregnancy, or the pup's development. So again, it's not directly applicable to humans. Numbers, of course, are very small, but it's a starting point. And then really the first type of data that we were getting about pregnancy came from what are called the phase 3 trials. So these were the trials where thousands and thousands of volunteers were recruited, and half of them received a placebo, so they were the control group, and half of them received the active COVID vaccine. And there were the same number of pregnancies with the same outcomes in both the placebo and the active arms. Now, the interesting thing is that the volunteers who were taking part in these studies were actually asked to not get pregnant. So these were what you could consider to be accidental pregnancies. And because of that, although tens of thousands of people were recruited in the various different trials, the numbers of pregnancies were very small. There were 66 pregnancies in the placebo or the control arm and 71 pregnancies in the vaccine arm. And this is why when these conversations were initially happening, we didn't have that much safety data. These are not strong data, although in terms of scientific quality, because these were randomized trials, actually it does have more validity than you might think just based on the small numbers. Next slide, please. But we're now in a much better position to know a lot more about giving the COVID vaccines to people of reproductive age. Now, we've got national databases, and these are population studies of hundreds of thousands of people. And the one that's used in the UK, which is relevant to the group that I'm talking about, is the UK Obstetric Surveillance System. And this is a national database of hospital admissions of anyone who is pregnant who's been admitted to hospital. So we've got good and secure data about pregnant people who are admitted to hospital. But in addition to that, in the United States, there is a huge voluntary database of over 80,000 pregnant people who've been vaccinated whilst pregnant or within 30 days of their last menstrual period. And of these over 80,000 people, over 13,000 of them are being followed in detail. And these numbers are correct. Oops, there's a mistake on my slide. That's of the 17th of January, not the 17th of February, 2022. And that number gets updated every few days. I think it's twice a week. And it's in the public domain. You can go and have a look at it yourself if you just Google vSafe, and it will take you to the website. Excuse me. Next slide, please. Now, the next type of safety data we've got comes from what are called prospective cohort studies. And this is where volunteers or recruits have been invited to join a study. And usually we're talking about studies that are in the hundreds or the thousands. And so the volunteers will have specific characteristics that are of interest to the study. So on the basis of what I'm talking about to you now, we'll be talking about studies on individuals and couples who are trying to conceive, those who are undergoing fertility treatment, if we're interested in periods, the regularity or otherwise of their periods. Next slide, please. And then there's the concept of professional opinion. And so what's been happening is that the professional groups have all been reviewing the data and giving their expert opinions on the data as it's been coming out. And actually the Royal College of Obstetricians and Gynecologists in the UK has been our national leader on this and has involved members of the Royal College of Midwives, the UK Tetralogy Information Service. So this is an expert body who look at abnormalities that can arise in pregnancy. So in other words, one could, these are often known as birth defects. And then there's the MacDonald Obstetric Medicine Society, as well as the British Fertility Society, and on a European level, the European Society of Human Reproduction and Embryology. So these groups are there to assimilate all of the research and then give advice and opinions both to the government as well as to individuals. So that's for pregnant people, their loved ones and their carers. So what do we know from these data? Well, before thinking about the COVID vaccines, I think we need to think about what does actually COVID do in pregnancy. Well, the good news is that pregnant people are no more likely to get COVID than non-pregnant people. And another bit of good news is that 2/3 of pregnant women with COVID have absolutely no symptoms, and that most of those who do have a symptom will only have a mild cold or a mild flu-like illness. However, if a person is pregnant and unvaccinated, the mother is much more likely to be seriously ill. And it's interesting that being of a young age is one of the risk factors for being seriously ill, as is being in first pregnancy. And for the baby is more likely to be born early. And that might not sound too dramatic, but it can have very serious consequences for the baby if that baby has to be delivered at an early gestation. And that can lead to brain damage, leading to developmental problems, or even sadly neonatal death. And the individual baby, if survived, can also be left with breathing problems, which can be short-term, medium-term, or sometimes lifelong. Next slide, please. So if we think about COVID and pregnancy in numbers, there's zero effect of COVID on miscarriage. There's zero effect of COVID on the baby's development, and that's structural, neurodevelopmental, brain, breathing, anything you'd like to mention. And another bit of good news is that there is no evidence that COVID is transmitted what we call vertically. So in other words, in pregnancy from mother to baby. And that the newborns who have developed COVID have generally been very well. They've not actually had many symptoms. They've not been ill. The difficulty with babies born to mothers with severe COVID is that often they've been born too soon. And it's not related to the type of birth, feeding, or separation. And of those women who've been admitted to hospital with COVID, 77% of them have been unvaccinated. And COVID infection affects 77% of unvaccinated pregnancies. And of those who've been admitted to hospital, over 96% are unvaccinated. But other complications of pregnancy are more likely in pregnancy when a woman has COVID. And that's preeclampsia, which is raised blood pressure or protein in the urine. The risk of being born early is increased by double, as is also the risk of stillbirth. Now, in terms of COVID and fertility, COVID does not reduce female fertility, nor is the chance of pregnancy per cycle affected by the woman having COVID. We don't know about the effects of long COVID. However, COVID does transiently reduce male fertility, but only within about 60 days. So that means that the chance of pregnancy per cycle is slightly reduced after male COVID, and the count and quality of sperm is reduced. And again, we don't know yet about long COVID. So what do we know about COVID vaccinations and having a family? Well, over 200,000 pregnant people have been vaccinated in the USA, Canada, and the UK. And so far, there have been no specific pregnancy-related safety concerns. Pregnancy and miscarriage rates are the same in vaccinated and unvaccinated people, and that's true for both natural and IVF pregnancies. And we've got data on over 10,000 pregnancies that have been reported after either the first or the second doses. We know that sperm count and motility is the same before and after vaccination. We also know that egg and embryo quality is the same before and after vaccination. There was a scare that maybe COVID antibodies could bind to placental tissue, and these are the antibodies raised by the COVID vaccine. We've now got data that shows that that does not happen. And then one final thing that has been raised as a concern when I've been talking to people is a misunderstanding about what mRNA is. And the mRNA that's in the vaccine cannot be incorporated into an individual's DNA. And then my final point is on that of COVID vaccines and periods, because there's been quite a lot of publicity about menstrual periods changing after vaccination. But there have been two large studies which would indicate that there might be some small changes that occur with periods, but these are very, very, very small changes. Now, in a large study of 6,000 Norwegians who considered themselves to have regular studies, 38% of them who were not vaccinated reported that their next period was different to what they would consider to be a normal period. And the main change was that the period would be heavier. That number went up by 1% to 39% after the first dose, and by 3% after the second dose to 41%. And then another large study from America of 2,400 women who consider themselves to have regular periods, reported that there was no delay to the time of their next period after the first dose, but there was half a day delay after the second dose. And interestingly, the delay seems to be by 2 days if both doses of the vaccine have been given within 4 weeks, i.e. within one menstrual cycle. but that the effect on the time in between periods has gone by the second cycle. I'm going to leave it there. But I wanted to leave you on my final slide. I'm not sure if what you're seeing has caught up with me, but on the very final slide, there is the reference of the RCOG, which is www.rcog.org. If anybody is interested in specifically reading advice for pregnant people and their carers, there is a decision aid that's put together there. There's also frequently asked questions produced by the British Fertility Society at bfs.org. And then Don mentioned Vicky Mail. Vicky Mail is a reproductive immunologist at Imperial College London, and she has assimilated what she very helpfully calls an explainer on the COVID vaccine. It's available. I've just put up her Twitter handle, which is Vicky, spelt with a K, V-I-K-I, loves facts, F-A-C-S, and you can find her on Twitter, and there is a link on Twitter to her Google Drive document, which she updates as soon as there's a new piece of information, and it's written extremely well, and I think is helpful for anyone with questions.